Hello, my name is Nathan Pearson, and today I will be presenting my advancing application proposal for the Rangos Prize entitled Trauma-Informed Care in the Health Sciences, which I've created in collaboration with Dr. Amy Mattila of the OT department. This past year, with funding from the previous prize, we were able to put on a one-day, 4-hour workshop, which consisted of an opening by the National Alliance on Mental Illness, followed by a lecture and discussion panel by professors in the nursing, speech therapy, occupational therapy, pharmacy, and education departments. And then we were closed out by Elizabeth Sherman, who runs a trauma-sensitive occupational therapy practice in Squirrel Hill, and she closed out the day with a trauma-sensitive yoga session. So if we received funding for the next year, we would be able to extend this one-day, 4-hour workshop into 4 to 5 one-hour workshops across the year, which would consist of 30 minutes of lecture, 15 minutes of a sample case, and then 15 minutes of discussion. And these can be offered both virtually and in person. And the first 3 to 4 sessions would be the traditional lecture structure, like I just stated. But then the last session would be out in the community in collaboration with a community partner who is doing trauma-informed or trauma-sensitive work out across the city. And at the end of the workshop series, the students would receive a micro-credentialing for completion. And so this graphic shows of the 35 students who participated in the workshop last year, the various majors who were represented across the university. The need for this project comes out of the Adverse Childhood Experiences Study, or ACEs, and the ACEs study found that chronic illnesses such as lung disease, heart disease, depression, and autoimmune diseases can all be linked to previous traumatic experiences. And so this workshop series would provide the students with a growing tool set they could carry with them throughout their educational and clinical experiences and into their future practice. And it would also allow for interdisciplinary discussion and approach to trauma and trauma-informed care. And of the students who attended this past year, one of the main requests was just to have more time for discussion, lecture, and sample cases. And so in this graphic, you can see some examples of ACEs are abuse, household challenges, and neglect, and roughly 67% of the population experience at least one ACE. And those who do experience trauma are 4 times more likely to become an alcoholic, 4 times more likely to inject drugs, 15 times more likely to commit suicide, and 2.5 times more likely to smoke tobacco. And so the innovation of this project is in that it is not taught extensively at Duquesne within any curriculum, and it would also allow for us to connect to neighboring communities and organizations by bringing in community partners for the lecture series, and then in that final collaboration session with a community partner out in the city. And this also helps to tie us into imperative 2, which is that Duquesne will become the region's flagship institution for community engagement through mutually beneficial partnerships that advance the city, the region, and the world. And the benefit is pretty wide with this project. It benefits directly the students, no matter what major they're in, whether they be health sciences, nursing, future medical school students, or even education. And through collaboration with Elizabeth Sherman and Carlow University, we'll be able to bring in students from Carlow University's OT department and other departments within their health sciences school. And it also directly benefits faculty who can attend and clinicians who can attend, and future clients and patients of the participants. And then at the very end, the students will receive a certificate of completion for the workshop in trauma-informed care, which they can put on their resume. Thank you very much.